Hello, good morning, good evening, everybody. I am Vaidya Asavari Manvikar. I would like to welcome you all to GCAR, Global Council of Ayurveda Research, Global Webinar Research Series. GCAR, Global Council for Ayurveda Research, is an international non-profit organization based off of USA. Our mission is to encourage, educate, and facilitate basic clinical and interdisciplinary research in Ayurveda. Our vision is to promote and establish Ayurveda as an evidence-based health science globally. You can learn more about us at www.ayurvedaresearchusa.org. Please do consider joining us as a member, which will bring you access to all our resources. No non-profit can operate and succeed without volunteers. So consider joining us as a volunteer and we can place you in a variety of projects based off of your skills and your interest. Once again, our website is www.ayurvedaresearchusa.org. Now I would like to introduce our eminent speaker today. Her name is Vaidya Triveni Dhepeshwarkar Kulkarni. She has completed Ayurved Visharad BAMS from BSDT's Ayurved College, Wagholi in 2016. She completed Ayurved Dhanvantari MS in Gynecology and Obstetrics from Dr. D.Y. Patil Ayurved College, Pune in 2021. She currently is pursuing PhD in Strirog Prasuti Tantra from R.A. Poddar Government College, Mumbai. She has been working as a Vaidya as Panchakarma Chikitsalay Aund, which is a pure Ayurvedic Chikitsalay treating a wide range of conditions from common ailments to complex cases like road accidents using Ayurveda. She is a gynecologist at Parivartan Ayurved Hospital, Kothrud, as an Ayurvedic maternity home. She works as a Vaidya at Vaidya Renuka's Ayurved and Panchakarma Center at Pune. She has been conducting normal and cesarean deliveries for the past 7 years. She has specialized work on Badaradi Niruha Basti in Garbhini for normal delivery with data collection over 100 patients. Her special focus is on natural delivery during the prenatal period and delivery. She has been promoting Ayurveda in women's health across all stages of life. She has strong clinical knowledge in Strirog, Garbhini and Balarog Karma Chikitsa. She has clinical knowledge about handling emergencies through Ayurveda. She has got many research awards and has publications under her belt. She has authored 5 scientific papers on Ayurvedic gynecology in reputed journals. She has got Best Paper Award at International Conference Sushruti 2023 for role of Badaradi Niruha and Anuvasan Basti in Garbhini Prasav and Sutika Avastha. She has Best Paper Award at MASD Conference for Stri Anapatya with reference to Ushnaguna. She was selected as a runner-up at late Vaidya PG Nanal national level competition. She has been conducting annual children's health checkups at modern Shishu Vidya Mandir, Pune for past 5 years and have been delivering health awareness lectures on menarche and menstrual hygiene in various schools. She has worked as a writer for blind students, providing voiceover recordings and study material, and wrote storybooks for blind children using Braille script. Let me give it to you. Let me hand it over to you, Vaidya Trivedi Dhepeshwarkar.
Yes, thank you. Namaste.
Namaste.
So, I really thank Global Council for Ayurveda Research and Vaidya Manvikar Madam for inviting me. I think I'll start with the presentation.
Mm-hmm.
Yes.
Yes.
I'll just share the screen. Is it visible?
Yes, it is visible.
Okay, great. Welcome you all, and I will start my topic with our group prayer. Gurur Brahma, Gurur Vishnu, Gurur Devo Maheshwaraha, Guru Sakshat Parabrahma, Tasmai Shri Gurave Namaha. So, warm welcome. Good morning to all the participants from USA and good evening to all the participants from Bharat. So, we'll start with our topic. Today's topic is Ayurved in Garbha-Garbhini Vyapad, which are the complications in pregnancy and how we can handle those complications in pregnancy through pure Ayurveda. So pregnancy is a natural state and it's not a disease. So though pregnant ladies go to hospitals and checkups, it is not a disease, and the patient and the lady is not a patient. So we have to treat that lady as a normal and healthy human being. So in pregnancy, regimen is important and not a treatment. If she follows a proper regimen, proper diet, then there is no need of any medicine and there is no need of any treatment. Only the Garbhini Paricharya, which has been told in our Samhitas, in our classic text, if she follows that, there is no need of any treatment. No Ayurvedic and no allopathic. So, what is the principle of Ayurveda is Swasthasya Swasthya Rakshana. Maintain the health of healthy people or healthy living being is our motto. Hence, Garbhini Paricharya is very important. But before that, Bija Shuddhi is of utmost importance. So we know that Garbhini Paricharya has been given in all the texts and all the Samhitas. But before that, if the Artav and Shukra is healthy, then the Garbha, which is going to be formed from those Bijas, that that Garbha will going to be healthy. So before pregnancy, I mean, conception should be always, it should be, it should not be accidental pregnancy. So before pregnancy, there should be Shodhan, there should be Deepan Pachan, and then after Bija Shuddhi, conception should be there. If there is Bija Shuddhi, then there are very least chances of Garbha Vyapad or Garbhini Vyapad. So what is Garbhini Vyapad? It is also known as Garbhopadrava. That is Garbhasya Upadravaha. The symptoms which are seen on mother's body either due to Garbha or due to unhealthy diet and regimen. So Garbha, when it is in first trimester or when it is formed in early pregnancy, it acts as a foreign body to the body, to the mother's body. So mother's body tries to omit it like any other foreign body, but nature tries to protect it. And the fight between that mother's body and nature, it reflects in some of the symptoms like rullas, nausea or vomiting or shotha. This is known as garbhopadrava, that is the upadrava or the symptoms which are caused due to garbha. In pregnancy, garbhini is like, it is mentioned in text like it is taila purna patra eva, means a vessel which is filled with oil, cut to cut, filled with oil. So we have to handle it very carefully. So the treatment which is going to be given in pregnancy should be very specific and which should not harm the pregnancy. So Actually, already Garbhini is like a fragile body. So we have to take care of Garbha, which is in early stage, and as well as mother's body. So in texts and also in practice, what we see is Garbhopadrava are Shosha. Shosha can be, we can say that there is a Dhatukshay or malnourishment. We can say that. Then Rullasa, that is nausea. Chardi, vomiting. Shofa, that is pedal edema or whole body edema. Then Jwara, Aruchi, Atisara, and Vaivarnya, that is Pandu. These are Garbhasya Upadrav, Garbhopadrava, which we see on Garbhini's body. And then next one is Garbha Vyapada. Garbha Vyapada means the symptoms which are seen on Garbha, or there is some problem or there is some deformity in Garbha itself. Those are Garbhasrava, Garbhapata, Mudha Garbha, that is bridge presentation or abnormal presentation. Then Upavishtaka and Nagodara, which we can correlate with IUGR, that is intrauterine growth retardation, and Mruta Garbha, that is IUD, intrauterine death. After that, in practice, we see many symptoms other than textual, what we can say, textual shlok. Some of those are Udarshula, Malavashtama, that is constipation, or Arsha, Parikartika, like piles, features, any other anorectal diseases. Agni-mandya is very common. We see this in our practice. Then Pandu, Shirashula. Uh, Recently, we had a patient of Garbhini Shirashula. She is having Shirashul since the day of first day of her pregnancy, and in last pregnancy also she was having the same problem with Shirashula. Then Apasmara, Brahma, like dizziness. Then Shwasa, GDM, gestational diabetes mellitus, and PIH, that is pregnancy induced hypertension. All of these we can see on Garbhini, or we can do pratyaksha parikshan of these symptoms. But some of the symptoms or some of the diagnoses are USG based. Right now we have this USG facility, so we can actually see the baby in uterus. So we can diagnose the deformity in early stages and we can cure that, or can proceed with the pregnancy. So some of the USG diagnosed deformities are deformity in bones, deformity in heart, deformity in kidney of fetus, then IUGR, that is intrauterine growth retardation, or SGA, we say that small for gestational age. Then oligo or polyhydramnios, that is the liquor quantity is either below the limit or above the limit. And some other anomalies also we can diagnose through USG. So, what are the causes of Garbhopadrava? As I said earlier, the first or the important reason is Garbha. As Garbha acts as a foreign body, the mother's body tries to throw it out. So, some of the symptoms are related with normal Garbha. It is not compulsory that there should be a deformity and Garbha, then only the Garbhopadravas are seen. Some of them are seen if the Garbha is Prakruta also, but the body, mother's body, as it acts as a foreign, as it uh, assumes that the Garbha is a foreign body, it tries to throw it out. So, the Garbha is one of the major factor of Garbhopadrava. Then other is deformity in Garbha. As I said earlier, if there is some physical anomaly in Garbha, we can see the reflection on pregnant lady. The third and very important reason is not following Garbhini Paricharya in the sense of diet as well as regimen. I mean, Ahar and Vihar. So, following this paricharya is very important to avoid Garbhopadrava and to avoid Garbhini Vyapad and Garbha Vyapad. So, this is very important that we should ask patients or we should ask the pregnant lady to follow it thoroughly in sense of diet and regimen. And next point is kledha. There are two types of kledha actually. One is Surushta kledha and other one is Dushta kledha. The Surushta kledha is very important in our body, which is good in nature, and it is very important for Garbhasthapana. Unless there is a proper kledha, then not will be it will be difficult for the pregnancy, for the conception. And the other one is Dushta kledha, which is not good in nature, and that causes, it is like a mud, so it causes what we can say, we have to throw it outside the body. In that in if the Dushta kledha is there, we have to do shodhana of the patient. So in this case, the causes of Garbhopadrava, Dushta kledha, if it is increased, if there is dosha sanchiti, then we have to do shodhana and then proceed. Then causes of Garbha-Vyapada. Garbha-Vyapada means deformities in Garbha. So first reason is Bija Doshi. As we discussed earlier, before conception, Bija Shuddhi is very important. So we have to do the shodhana of both the partners, that is wife and husband, and then we should ask the couple to proceed for the conception. Then again, not following Garbhini Paricharya. Third one is physical or mental trauma. We usually see in practice that if there is some mental trauma like death of a loved one or anything which causes a super mental trauma, it can cause or it can lead to abortion in early pregnancy. So this is one of the major factor of Garbha-Vyapada. And the last one is Jata Harini, which is explained in Kashyap Samhita in detail. That is Daiva is the major factor of Garbha-Vyapada or deformity in Garbha. The next we can see that is generalized treatment of Garbha as well as Garbhini Vyapad. The first sutra which is mentioned in Ashtanga Rudaya as well as Charak Samhita is Vyadhischasya Mrudu Sukhaihi Atikshणैः औषधैर्जयत. Whatever the Vyadhi we see or whatever the symptom we see in Garbhini, it should be treated with Mrudu, Sukha, I mean mild, Atikshණai, Aushadha. This should be the basic principle of the Garbhini Chikitsa. And the second and important is the treatment which is beneficial to both mother as well as the fetus. So the medicines we use orally as well as externally should be like Mrudu, Madhura and of Shitavirya. The third point is Anulomaka. That is the, we can say the laxatives or purgatives medicines should be regularly in the, regularly in pregnancy, because there is so much bombarding of everyone in the home tells the pregnant lady, eat this laddu you should eat, this porridge you should eat, these fruits you should eat. So there is some clay which is stored in the body, which is not useful for the fetus as well as the body, as well as mother's body. It should be eliminated through mala. So anulomaka medicines are very important in pregnancy. Avoid tikshna shodhana. This is very important. And there are some diseases or some symptoms in which shodhana might be required. So uh, in text, it is said that in such cases, tadarthakari chikitsa should be given. What does mean? That where nasya is expected in normal people or normal diseases, but in pregnancy, you should advise ghee or oil application in the nostrils. Or where in the symptoms like where virechana is expected, but in pregnancy, you should give anuloman. Where vamana is expected, you can give Sthivana Chikitsa. That is the treatment which initiates spitting. So dosha shodhana in a mild or gentle way can be done in pregnancy. And the last but the important is, if Garbhopadrava is untreatable, abortion is advised in Ayurveda also. So this is known as Hetu Viparita Chikitsa. If the symptoms are of in huge quantity or which are untreatable, then the Garbhasrav should be done with medicines. After that, this is the list what we can use in pregnancy, which are safe in pregnancy. Some of the I have tried to give some list of these medicines. It is like Siddha Jala of Laja Suvarna. How to prepare Laja Jala? I will demonstrate it or I will show the video afterwards. Then Musta, Shunthi, Ushira, that is Khas, and Kamala, that is lotus. Siddha Jala of these drugs can be used in pregnancy. They are totally safe. Then Siddha Yavagu of Dashamula, Dhatri, Dhanyaka, Jiraka can be used. We can how to prepare Yavagu is like you have to take rice, then 6 times water, and you have to cook it. And while cooking, you have to add these medicines in that. In powder format or churna format, you can use Yashti, Ananta, Dhatri, Badara, Vidari, Ananta, and the list goes on. I have just mentioned some of them. Then Swarasa, that is fresh juice. We can use Amruta, Durva, Tulsi, Swarasa. Again, decoction of Masanumasik decoction. I'm going to explain that in next slide. And the Shamur Yashti decoction we can use. Plain Yashti kwath we can use. Then Ananta Manjeshta kwath we can use. Again, Fanta and Hima can be used of Tulsi Bija, Kamala, that is again lotus, Chandana, Durva, Draksha, that is black raisins. Avaleha, which is in the format we can like Chavanprash. So we can use Avale of Dadima, that is Dadima Avaleha, Vasavaleha, Kushmanda Avaleha. Kushmanda is Ashgard, and which is very beneficial in pregnancy to increase the weight of fetus. It is very the first line of treatment in IUGR or small for gestational age. In Chavanprash, we can use as a Rasayan. Again, Gandha, that is a pest or lep. We can use Chandana Gandha in Purva Roop of Garbhasrav, that is threatened abortion. Then lep, Udara lep, the application of paste on lower abdomen. We can also use this in threatened abortion to avoid complete abortion. The medicines we can use are Chandan, Rakta Chandan, Karpura Shunthi, Jati Phala Lep can be used in Garbhini Jwara. Sphatika, that is alum, also we can use in to avoid abortion. Guruta and oil we can use in different format for abhyantar, oral as well as external application like basti or udara pichu, yoni pichu. This can be a number of types like balak, shira balak oil, kshira yashti oil, narayan oil, dhanvantar oil. And in gruta also we can use shatavari, ashwagandha, gokshur, dadimadi or jivani yagana. Then in combination of what we can say, combination of churna, we can use Dadimastak or Mahakhanda. Mahakhanda is very useful in Garbhini Aruchi or Garbhini Rullasa, Chardi. Then Pushyanuga Churna, which is mentioned in Pradara, we can use this churna in to avoid abortion or piles or fissures in Garbhini Avastha. We can use Sitopaladi Churna, Chandanadi Churna, Vasanta Kalpas like Laghumalini Vasanta, Madhuvalini Vasanta, Suvarnamalini Vasanta. Then Garbhapal is well-known drug in Garbhini Avastha. Praval Panchamrut, Kamdudha, Tapyadina Vayasloha, Punarnavadi Mandul. And the Rasakalpas like Suvarnamakshik, Shankha Bhasma, Mauktik Bhasma, Mauktik Kamdudha, Suvarna Bhasma, Loha Bhasma, etc. Also, generally, Asava rishtas are contraindicated in pregnancy, but in some of the cases, we can use Asava rishtas. Like if there is hemorrhage or hematoma in pregnancy, or there is some septum in fetus, or there is some what we can say cyst in fetal kidney, then we can use in such cases we can use Asava rishta like Draksha Sav, Ashwagandha rishta, Loha Sav. one of the case where asava resistance has played a very important role. I'm going to demonstrate that later. So these are some of the dietary products, or we can say some of the important uh, products we can ask patient to prepare at home, and which are very beneficial in pregnancy. The one of that is laja jala, which is a home remedy and very easy to prepare. It is instant energy booster. It we can I mean, we can see very good results of Laja Jala. If it is Suvarna Siddha Laja Jala, then it gives excellent results, and it is beneficial in nausea, vomiting, dysentery, indigestion, specifically Rasakshay, and it is useful in Jwara and Trushna also. It is very easy to digest, and it gives good result in oligohydramnios and ayurveda. And a very important factor of Laja Jala is it can be given through different routes. That is, it can given orally or through basti or through local application or udar pichu, that is abdominal binder, and basti through also we can give that, and also as a IV saline we can give Laja Jala for Tarpana. Again, Suvarna Siddha Laja Jala or Suvarna Siddha Dugdha is also important, and it is very beneficial in pregnancy, as it is Bala, Varna, Smruti, and Buddhi Vardhaka. That is, it increases strength, it gives good complexion to baby, it increases memory of baby and intelligence. So, and also it increases strength of Garbhini itself, which is very beneficial, or very much required in the late pregnancy and in labor. And also, as it is made up of Suvarna, that is gold, it is Vishagna. So, it is useful to nullify the toxic effects of other medicines. It boosts immunity of both mother and baby. It is beneficial in IUGR, cardiac anomaly, or intermediate or high risk in double, triple, or quadruple marker. Also, it gives good results in oligohydramnios, and it is very much important in or beneficial in threatened abortion. So, this is the small video of how to prepare Laja Jala. These are the Laja, that is rice puff, and you can make the Laja manda at home in a very easy way. This is Harpara Siddha Jala. This is a piece of earthen pot, and you have to heat it on a flame until it becomes hot red. You have to deep it in a room temperature water until that sound comes, and then you have to repeat this procedure for 7 times, and then you have to filter it or take the water in a glass, and you can have this water throughout the day, in specifically in Garbhini, Chardi, or Ullasa. So this is a simple dietary supplement which we can ask patient, or not patient, to Garbhini, which she can easily prepare at her home, and which gives excellent results. So next, this is all about Abhyantar or internal medication, but there are some karma we can perform in Garbhini. Some of those are Matra Basti, which is very beneficial, and it is in general, it is as a regimen, we advise that Matra Basti in the 9th month for normal labor or for Sukha Prasava. But in some of the symptoms like Admana, IUGR, Arsha, Parikartika, like anorectal diseases, or Udar Shula due to Ajirna or due to Malavashtambha, and also in threatened abortion, we can give Matra Basti. There are n number of medicines we can use for Matra Basti like Bala Tel, Bala oil, Kshira Bala oil, Yashti oil, Dhanvantar oil, or in constipation, Malavashtambha or Ajirna, we can use Chinchalavan oil also for Matra Basti. In threatened abortion, that is Garbhasrav Purvarup Avastha, we can give Matrabasti of Gruta like Shatavari, Gokshura, Dadimadi, or Gruta which is prepared from Jivaniya Gana or which is prepared from Garbhasthapana Dravyas. We can definitely use that. Then Badaradi Niruha, as Asawari madam told that my MD thesis was on Badaradi Niruha and it is very beneficial. It gives tremendous results in 8th month and 9th month of Garbhini. We can use that as a regimen and it is Sushrutokta. It is given in Sushrut Samhita and it gives excellent results in IUGR, in oligohydramnias, in it definitely beneficial for Sukha Prasava, that is normal labor, and not only that, it gives good result in Stutika Avastha also. It reduces your lower backache, abdominal pain. It results in good uterine, what we can say, Garbhashaya Rhas, and also in Stanya Pravrutti, that is lactation. The next one is Kshira Basti, which is very beneficial in IUGR. We can give the Kshira Basti of Ananta, Ashwagandha, Shatavari, Kamal, Durva, Vidari, and other drugs which are balya in nature. Again, Udar Pichu. This may seem a very, what we can say, very simple remedy or very simple treatment, but it gives excellent results as there is a absorption of ghee or absorption of oil through skin and it directly goes to the fetus. So Udar Pichu is beneficial in abdominal pain or threatened abortion, IUGR, oligohydramnias, fibroid with pregnancy, and also in preterm labor. Again, medicines you can use of your choice, like Mrudu Sukhai or Tikshna medicine you can use. Yoni Pichu is given as a regimen or as a Garbhini Paricharya in 9 months, and also as a treatment we can use Yoni Pichu in short cervix. The Yoni Pichu should be in a tampon size. I will show you the video so that it covers whole vagina and it goes to the cervix and will be beneficial in avoiding preterm labor. Again, local snehana can be used as a Garbhini Paricharya or in IUGR with Bala oil, Kshira Bala oil, Yashti oil. And then Lepa we can use in Garbhini Jwara, the Lepa on forehead with Karpura or Jati Phala. And again in Shof also like Pada Shofa, Mukha Shotha, we can use Lepa of different Shothagna Dravyas in pregnancy. This is the small video of how to make Udara Pichu. You can ask the patient to apply this pichu and can go to sleep so that the pichu remains there for 6 to 8 hours, which is also beneficial. This is Yoni pichu. I'll just skip it and I'll just show you how it looks. So this is like a tampon shape and you have to tie a thread to that which will be outside the vagina and this should be inserted in a vertical position so that it completely covers the vagina, that is Dvitiya avarto of yoni. So this should be sterilized and it is dipped in ghee, medicated ghee or oil and then inserted in the vagina. So this is Badaradi Niruha. As I have told earlier, it is the reference from Sushrut Samhita. These are the combination of Badaradi Niruha, and which is very beneficial. I will definitely suggest you all that you should do this Badaradi Niroha in 34 or 35th week of pregnancy as a regular regimen in pregnancy, and it definitely helps in ninth month of pregnancy, which is very crucial, and in labor as well as in Sutika Avastha. So these are the ingredients of that. I'll just go forward because there are some cases I have to discuss with you. So yes, the first and very commonly seen Garbhopadrava is Garbhini Chardi. As I have told earlier, Garbha is the mother's body treats Garbha as a foreign body, but nature tries to protect it. And there is some there are some symptoms which we can see on Garbhini. The Agnimandya, Samata, and indigestion. If the Garbhini Chardi is as a disease, then these are the causes of that. But if the Garbhini Chardi is Prakruta, as we know that there are in Prakruta Garbhini Lakshana, that Sadyogruhit or Vyaktagarbha Lakshana, Chardi is the main symptom. So Rullasa and Chardi we definitely see, but it is common in first trimester. But if it continues or if it is adversely affecting the health of Garbhini, then it can be taken as a Garbhopadrava. There is a type called Dvishtarthaja Chardi, that is nauseatic feeling even for good fragrance or like perfumes or even tadka or the food which is very actually the Garbhini likes that, but when there is some smell of that typical thing or there is odor, it causes the nauseatic feeling. Then Rasaksha is also one of the important cause. Saumya Shukra and Agneya Artava. We know that when they meet, there is an exchange of gudas and which results into some of the symptoms like Rullasa, Chardi or Shotha. As I told earlier that this Garbhini Chardi is very common in first trimester, but it should not harm the regular day-to-day activity of Garbhini. If it is in first trimester itself, there is no need of any treatment or just change in diet and regimen is required, and it will be definitely beneficial. Liquid diet or dry fruit like dry food like laja or biscuits or toast, wheat toast can be beneficial. Easily digestible food, then food with regular intervals and in small quantity. That asks the Garbhini to eat 5 or 6 times a day, but in a small quantity. That will be beneficial for her Chardi and Rulhas. Then the generalized treatment is, as we discussed earlier, Laja Jala and Kharpara Jala gives tremendous effect in Garbhini Chardi or Rasakshay. Then Mashi is very nice, what we can say, uh, sankalpana or kalpana of in Ayurveda, which is very beneficial in stambhana. So it can be used in Garbhini for stambhana of Chardi. How to prepare mashi? I am going to show you the video. Then jujube powder, rock sugar, amla jam, mango powder and jamun powder with honey. We can give that in a avaleha format. And some of the medicines like Praval Panchamrut, Kamdudha, Gairik, Shankhabhasma, Suvarna Sudshekhar or Praval Pishti, Bhunimba, Chaturbij, Badara. These are some of the medicines we can use to treat Garbhini Chardi. Then Pichu on abdomen also gives result because due to Chardi, there is abdominal pain and the patient or the woman gets very irritated. And the treatment which is mentioned for Rasakshaya, we can use every medicine from that in Garbhini Chardi. So this is the small video of how to prepare mashi. This is Ela, that is cinnamon. No, cinnamon, sorry, cardamom. So you have to take 4 to 5 cardamoms in a hot pan and roast till it becomes black as a ash. This is narikela mashi. This is the skin of coconut. Also, the procedure is same. Roast them till they turns black. And you have to ask the lady to eat this mashi with honey. So this is one case of Garbhini Chardi, which she was 30 years old primary. She was the case of infertility. And there was Chardi since the day of missed period, like the day of first day of her pregnancy. And severe vomiting was there, 7 to 10 times she was vomiting. And there was pitta dominance with burning in throat, as well as there was urodaha, and there was a nauseatic feeling throughout the day. She was unable to eat anything. There was annadvesh, even for her favorite food, she was not able to eat that. There was severe adhmana, and that is gaseous distension, and it was continuing even beyond first trimester. Gestational age when she came to clinic, it was 13 weeks, and scan double marker, everything was normal. So initially, we gave her Laghu Malini Vasanta, Garbhapal Ras, Praval Pishti, and Shankha Bhasma. This is for Deepana Pachana. And as we see, Mayur Picha Mashi, like the mashi of peacock feather, which gives excellent result in Garbhini Chardi and Rullasa. Along with that, we gave Bhunimba and Mahakhandav Churna. For Anulomana, continuous Anulomana, we gave Isabgol and Dhatri. The main part of her treatment was her diet. So we advised her to take Laja Jala, Kharpara Jala throughout the day. Instead of normal water, we asked her to drink Laja Jala. Then Dadimarasa, that is juice of pomegranate. Khas drink, Kharjuradi Mantha, that is juice of dates, along with pomegranate, along with Laja, you can have that. Then coconut water, vegetable soup, green gram soup, peya, Laja, fried gram, rock sugar, and wheat toast. Her main treatment was her diet. Then after that, when she reached her gestational age was 20 weeks, anomaly scan was done, which was absolutely normal. The chadi was reduced, but still it was 3 to 4 times per day. Pitta dominance was still there. Then beta test in mouth was there, and annadesh was little reduced, but still it was there. Then previous treatment was continued, and Praval Panchamrut was given in large quantity. And for Stambhana, we gave Pushyanuk Churna and Bilva Shunki. For her, we advised Udar Pichu for 2 to 3 hours a day till her delivery. At 28 to 36 weeks, there was still chardi, but it was reduced, and there was only one time chardi per day. Rullasa was quietly reduced. Hunger was good. She was able to eat something. And at the 35th week, we gave her Badaradi Niruha. After Shodhana, she gave excellent result, and there was a good result was seen in her chardi. But her Laja Manta was continued from day 1 till the date of delivery. This is her child. Emergency cesarean was done. Healthy male baby with 2400 gram was delivered. There was no vomiting after delivery. In September 2024, last year, we performed Virechana, and now she is second time pregnant with only one chardi per day in first 2 months, no vomiting for third month, and healthy pregnancy is going on. Next Garbhopadrava is Garbhini Shotha, that is edema. It is common in or after 7th month due to pressure syndrome. That is due to increased pressure of increased weight of fetus and liquor. The size of uterus increases and there is pressure on abdomen, on bladder, and due to this there is pressure syndrome and there is pedal edema. Other than that, if there is shotha in, I mean, normal pregnancy, other than that, there will be short due to big baby or polyhydramnios or malpresentation, pregnancy with fibroid, twins or multiple pregnancies, and obesity. Some of the causes of Garbhini Shotha are Guru, Amla, and Lavana Ahar, curd, non-veg in large quantity, butter, cheese, paneer, tofu, etc. Then long-standing during the pregnancy and not proper rest. And Pandu is also the one of the cause of Garbhini Shotha. The Samprapti, we can say that due to these causes, there is Vata Prakop, which causes Dosha Prakop, and there is a Dosha Sanchay of in Tvak and Mausa, which causes Shotha. There is Sanchiti of Ama, and due to this Ama, there is Shotha on Mukha, Netra, Pada, Hasta, etc. So, initial line of treatment or first line of treatment should be Ama Pachan. The shot can be local or full body. In local, it is on pedal edema or edema on hands or orbital edema. Some of the patients tell us that there is edema on face only in the morning. So in such cases, Amapachan and then Agnidipan is very important. So the generalized treatment for Garbhini Shotha is Punarnava, Gokshur, Chandan, Ushir, Manjishtha, Musta. We can use in different formats. In tablet forms, we can use Punarnava Mandur, Gokshuradi Gugul, Amapachak, Chandraprabha, etc. Generally, in modern science, the pedal edema is associated with hypertension, and that results into PIH, that is pregnancy induced hypertension. So, if the patient comes to us with high BP and pedal edema, we can treat her. Obviously, we have to do the Samprapti Bhanga, but for this type of patient, we can use this Kwatha, that is Punarnava, Yashti, Shatavari, Gokshur, Musta, Sariva, and Devdar, each in 3 gram, and we have to prepare a decoction of that. And as a Prakshep Dravya, we can use Shunthi in 1 gram. This gives excellent results. We can use this from 7th month to 8th month or 9th month till delivery. And this gives excellent result in pedal edema as well as her hypertension. Again, local application in a form of oil or in a form of lap. We can give Punarnava, Gokshura, Rasana, etc. So this is the one of the case of Garbhini Shotha. She was primary and again case of infertility. The patient came to us at the gestational age of 20 weeks and she was having severe bilateral pedal edema. The edema on left leg was more than that of right and there was severe leg pain. She was not able to stand more than 10 minutes. Weight gain was 5 kg in 2 months and again there was some of small for gestational age fetus. The fundal height was less than gestational period. So initially she was given Punarnava, Madhumalini Vasanta and Garbhapal Ras and Chandraprabha Shrunga Bhasma in morning evening, and at night for Anulomana she was given Isabgol, Yashti and Dhatri. In this patient, she was having a history of krumi and there was so much samata before pregnancy. And again, there was a dushti in her husband. He was having Agni dushti and Medo dushti. So, both these causes result into Garbhini Shotha. So, Pachana, that is Amapachan, was the initial thought behind this statement. This was the photos. This was in 5th month of pregnancy, so it was not natural. And you can see the edema was severe. So after these medicines, follow-up was taken 10 days after medication, but the edema was still there. So treatment was slightly changed and some of the additions were given like Punarnavadi, Navayasloho and Patoladi Churna was given. Along with that, we generally don't use such decoctions, but in this case, Pachana was very required. So we use Mahamanjishtadi Kadha and Maharasnadi Kadha. Along with that, local application of Lepa of Nirgundi, Ushir, Musta, Punarnava, Amruta and Shunki. After this local application and this quarter, edema was reduced to 80%. Both legs blackish discoloration was there, but it was also reduced after 15 days of continuous medication. Again, in 34th week, we gave Niruha Basti, that is Badaradi Niruha. And after that Shodhana, she gives good result, Basti gave good result, and pedal edema and blackish discoloration was reduced to almost 95%. And emergency LACS was done at term, and baby boy with 2500 gram was delivered. 10% edema was still there 10 days after delivery, but it reduced gradually in postpartum period. The next one is Garbhini Pandu, which is also very common. It is specifically in Garbhini Pandu, the causes are mentioned like eating inedible food like soil or chalk. There is a dauruda of Garbhini to eat such things. Then Amla, Ushna, Shara, Lavana, this rasa can cause Pandu. Stress, mental stress and physical exertion can also lead to Pandu. Indigestion is the basic principle behind the Samprapti of Pandu. So Samprapti we can say due to this Hetu Sevana or due to these causes, there is Rasa Rakta and Pitta Dushti which causes Srotas Avarod and Indriya Balahani which finally results into Panduta. So Pandu we can see as a symptom as well as a disease. If it is symptom, it is easy to treat, but as a disease, it is really hard to treat. And specifically in Garbhini Pandu, HB is not the only criteria. We have to see her dhatus, we have to see her agni, and we have to see the patient is as a whole, and not only we have to treat the HB, or we don't want to treat the reports. We have to treat the patient. So clinical features and Samprapti Bhanga according to that is very important. We can see paleness, orbital edema, leg cramps, loss of hunger, agni-mandya, dyspnea, exertion, or anger issues like things in Garbhini Pandu. So the generalized statement is Snehana, Abhyantar as well as Bahya. For Abhyantar Snehana, we can give Dadimadi Gruta, Drakshadi Gruta, Kalyanaka Gruta, Gukshura, which are safe in pregnancy. Then we can give Tapyadi Loha, Navayas Loha, Loha Bhasma in small quantity, Suvarna Makshik, Muktik Bhasma. Churnas like Ananta Manjeshta or Dadi Madi, Drakshadi. In this case, Kharjuradi Mantha, which is also a homemade recipe of Kharjur, that is dates, and pomegranate are the main ingredients of this mantha. Black raisins we can use, decoction of black raisins we can use as anolomak as well as Rakta Prasadak. And in this case, Asavarishta like Loha Sau, Draksha Sau, Ashwagandha Rishta we can use in pregnancy. So this is very special case I want to share with all you. This was the typical case of anemia, we can say. Also, of course, there was Pandu and there was clinical features of Pandu, but as a what we can say on paper, the reports were saying she was having severe anemia. She was 32 years old with G3P2 and previously there was 2 normal deliveries. And at the third time she came to us with 8 weeks of pregnancy and HB was in the range of 4.4 to 6.1. Also in previous pregnancies, she was having same condition, but the HB was within the range of 7 to 10. But this time it was tremendously reduced to 4.4. There was Chardi, Sarvanga Gaurav, that is heaviness in whole body, Brahma, dizziness was there, and blackout she was experiencing. Also, there was Anannabhilasha, that is anorexia, and lower back pain was there throughout the day. Her mala was asamadhankarak. She was facing indigestion, constipation, and anal pain also. So initially we gave the treatment of that is containing Praval Pishti, Tapyadi Loha and Suvarna Makshik Bhasma along with Garbhapal Ras and Chandrakala Ras. The Anupan given was Dadimavaleha, and in this case granules, sugar coated granules were given in the form of Kalpa of Ananta, Durva and Arjuna. After 3 months with same treatment, proper gestational development was seen, but the Pandu was as earlier, and there was other symptoms like Kasa and Kathinamala, that is constipation or heart stone. The treatment was slightly modified, and Navayasloha Vidari Churna Ananta Kalpa was given with Sitopaladi Churna for Kasa. Madhumalini Vasanta was given as it is beneficial in gestational development and Amagarbha. Then Makshika and Garbhapal was continued. Along with that, for Mrudu Anulomana, Samasharkara Isabgol Yashti Dhatri Churna was given along with Dadimadi Kruta. In her diet, Kharjuradi Mantha, dates, dates, pomegranate, beetroot, and specifically ghee in large quantity was advised. So these are her reports. We can see that on 22nd of July 2023, the HB was 4.4. Other reports were normal, but her gynecologist and the modern medicine were telling that this is not good and you have to do blood transfusion and you have to terminate the pregnancy. But she came to us and we assured her that we will try our best and will try to increase the HB on our terms. So injection Orofer were given to in her hospital, but there was some adverse reaction and she faced severe vomiting, which was blood stained. Again, headache, drowsiness, hypotension was there, and she was shifted to ICU for 1 day. She got stable after 24 hours, but there was no chance of giving injection Orofer IV again. And she came to us and we gave Deepan Pachan and a Rakta Prasadan Chikitsa, which was continued, which was mentioned earlier. And then when a special treatment was given to her, which was Rakta Basti. I will show you the video, and it was given weekly once for 3 weeks. And you can see the results. Like it in July, it was 4.4, and after the treatment in September, it was 10.8. And Bhardaradi Niro was given again in September, that is on 35th week, and after that weekly Matra Basti was given. This is the video of Rakta Basti. Like Sira Ved, we take blood from her husband itself. Before that, general examination was done that the Rakta was Shuddha, that is Arakta, Tanu, thin, without any pungent odor and without, there was no Sashabda or Safena Rakta. Then only we took that. And after taking that, we just inserted it as a basti. Basti Pratyagam was after 3 hours or 4 hours and with Mala and Alpa, that is slightly blackish in color. But after that, you can see the results that HB was increased and her Pandu was totally treated. On 5th of October, she delivered a healthy male child and she normally delivered it with 2050 gram. Though the weight was less, there was no need of any NICU or there was no need of ICU for the patient. And at the time of delivery, the HB count was 10.9 and also no blood transfusion was required. This is the child of that patient. And after that, the special part was after that, after delivery, she followed proper Sutika Paricharya. She took proper medication, and we can see that on 3rd of August 2024, her HB count was 13.9. So we can take a case of 4.4 HB also, but we have to treat that on our diagnosis and our criterias, and we have to treat likewise, so we can show the results in modern terms also. Then Garbhini Jwara, this is very common due to Rasadhatu Dushti, and some of the external factors are responsible, like due to weather, due to exertion or mental stress. The treatment is very common, like Langhanam Laghu Bhojanam, but in pregnancy, no complete Langhana should be given, but easily digestible food should be there. And medicated water, Sitopaladi Churna, Suvarna Sut we can give. This is again common problems we have to face, that is gestational diabetes and hypertension. But along with report, you have to focus, or more focus should be given on Agni and Samata, because there is a lack of exercise in pregnancy, and too much sleep or snigdhata madhura diet can lead to dushta kleda sanchay, and which leads to srotorod. So here indigestion, ajirna, and changes in physiology and anatomy of lady can lead to agni and amadushti. So this was the case of GDM, 33 years priming with history of ectopic pregnancy. Her gestational age was 7 weeks by LMP but 5 weeks by USG. Sugar was fasting 152 and PP 190. According to allopathy, there was complete restriction of sugar and daily 40 to 50 units of insulin was advised. The treatment given was Laghumalini, Tapyadi, Chandraprabha. Mustashunthik Shirapak was given. She was not having any type of milk or any type of sugar, but this Shirapak was given to her. And Dhanvantar oil, Udar Pichu was advised due to history of ectopic pregnancy. Diet and yoga was very important in this case. So this was the diet suggested: good quality food, cow's ghee, panchamrut or seasonal fruits she can have, laja, jawar puffs, beetroot, and strictly no food after 8:30 p.m. and specifically avoid paneer, tofu, cheese, uncooked sprouts or salad. 20 weeks USG, she showed 1 week IUGR, 1 week of lag, and uterine artery was showing increased resistance. Treatment was continued and Praval Panchamrut was given at night till delivery for Pachana. Then her insulin was tapered down because BSL was in control, and she shifted to glycomet with single dose. Again, treatment was continued. For IUGR, she was advised Kshirabasti, and Kshirabasti was given with Ashwagandha Shatavari Siddha milk of 50 ml. As a result, at 33 weeks, the fetal weight increased and it was 2042 gram. And the best result was that the glycomet discontinued, BSL was under control, and there was no any adverse effect of GDM on fetus. And in December, normal delivery was there, and female child with 2700 gram. No postpartum complications were there. Breastfeeding started from day 2 and BSL is normal till date. Again, this is the case with fibroid. So this is Garbhini Vyapad. Pregnancy with fibroid. Age was 28 years. She was married 3 years ago. And there were multiple fibroids with the measurements we can see on screen. The symptoms were lower abdominal heaviness, dysmenorrhea, vaginal pain. The treatment for fibroid was given. And then after 2 months, UPT came positive. ANC started, this was high risk pregnancy because there were 4 fibroids. So, and we know that if there is a treatment for Garbha-Vruddhi, it eventually increases the size of fibroid. So we have to take care of for that fibroids should not be increased. This is the USG report of that pregnant lady with 33 weeks, and there was an intramural fibroid. 2 fibroids were there, 12 centimeter and 9 centimeter. In this case, the aim was to complete the gestational period till expected delivery date and achieve Sukha Prasav. So Chandraprabha, Shrunga, Trivanga was given, Laghumalini, Vasant given, monthly Kalpa is given, and Udar Pichu with Dashamul Gruta was the main treatment, because due to Dashamula there is shrinkage of fibroid, and Gruta it protects the Garbha. In 7th month, there was right abdominal pain. After sonography, it showed two fibroids, large fibroids, but the fetus was good and weight was 1675 grams. So medicines continued. Here also Badaradi Niroha and Matrabasti was given. And then there was a gain in fetal weight, that is 2100 gram. At 38 weeks, she delivered normally with fibroid and baby boy with 2250 gram. Her her labor and her postpartum was absolutely healthy. This is a baby. And 6 months after delivery, their USG was done and there were two fibroids, but the size was reduced. And right now, the treatment for fibroid is going on. Again, this is very critical or very tricky symptoms which we see in Garbhini, that is Udarshula. Udarshul can be normal or abnormal. If it is in early pregnancy, it can be due to threatened abortion, spontaneous abortion, or due to severe vomiting, indigestion, or constipation. But in late pregnancy, there are two reasons like preterm labor or term labor. Term labor is physiological pain, but in preterm labor, it is not normal. So we have to treat that. In Garbhasrav Purvarup, that is threatened abortion, the main cause is Bijadushti, as we discussed earlier. Then diet and regimen are along again the causes. Accident, sexual intercourse in early weeks, exertion, mental shock are also the reasons. Daiva and Yoni Vyapad are also the important factors in Garbhasrav. So early treatment can save lives. It is possible to maintain the healthy pregnancy if properly treated in Purvarupa Avastha. So what we can see as a Purvarupa of Garbhasrav, these are lower abdominal pain, lower backache, PV spotting or bleeding, and severe constipation. And the generalized treatment is or Garbhasthapana, Jeevane Chikitsa or Garbhasthapaka Chikitsa, complete bed rest, diet and regimen, and monthly treatment or monthly decoction. This is the reference from Sushrut Sharir. We in our clinic we have prepared sugar coated granules of these to avoid abortion and for month-wise development of baby. So this is like Madhukam Shakabijam. First line is for first month, second line is for second month, third line is for third month. Likewise, there are 9 different culprits. So generalized treatment, we can add Durva, Ananta, Brahmi, Badara, Gairik, Pushanu. All these drugs are Garbhasthapaka and we can use these in different forms like internal or external in the form of Udar Pichu, Yoni Pichu, Basti, Snehana, Avagaha. And in diet, we can advise Makhana, Laja Jala, Rock Sugar, Kharpar Siddha Jala or Shingada. This is very interesting case of Garbhasrav Purvaru. She was 27 years old with G2 and a previous history of abortion. Her LMP was 19th of October. You can see the reports. I don't have to say anything. There was UPT positive. It was strong positive, but there was PV bleeding, PV spotting and vomiting. So this is the first report. You can see the report that there was a complete abortion. But though there was this sonography report, the focus was mainly on her clinical features and on her Vyaktagarbha Lakshana. She was showing all the Lakshanas of Garbhini, that is Tanayo Krishna Mukhata, Romaraje Udgamasatha, Akshipakshmani Chapyasya Sammilyante Visheshatha, Akamakatha Chardayati, Gandhat Udvijate Subhat. These are the symptoms of Vyaktagarbha Lakshana. All the symptoms were present in her, and other parikshan was Nadi parikshan. So in her Nadi parikshan, it was a Garbhini Nadi. So we decided to continue with this and we decided to treat her and not to abort the pregnancy. So after treatment, you can see that in December, the single fetal pole was seen corresponding to 6 weeks. But still, there was no cardiac activity. Again, we focused on clinical features and NADI and we asked the patient to continue the pregnancy. The treatment given was Laghumalini Vasanta, Garbhapal, Praval Panchamrut. Monthly granules was given as we discussed earlier. Garbhini Paricharya was strictly followed by the patient. Udar Pichu of Shatavari Gruta and granules of Durva, Ananta, Bala and water was given, which is Garbhasthapak in nature. So you can see the reports. But again, she showed different types of complications in her pregnancy. The cardiac activity was there on around 6 weeks, but there was subchorionic collection or subchorionic hematoma of large volume, that is 11 to 12 cc, and the size was 4.5 into 1.6 into 3 centimeter, which was very big at that gestational period. Again, the treatment was given, but at the gestational age of 8 weeks, she showed that there was persistent subchorionic bleed and of 16 to 17 cc of volume was there. There was again another subchorionic bleed measuring 2.3 into 2.5 centimeter, which was of 3 to 4 cc and which was occupying 50% of gestational sac. Again, there was a lag of 2 weeks in gestation, that is gestational age in according to LMP and according to sonography, there was a lag of 2 weeks. Treatment mentioned is Madhumalini Vasanta, Garbhopal, Praval, Panchamrut, Lakshmi Vilas. Again, monthly granules were continued to avoid the abortion. Garbhini Paricharya and Udar Pichu granules was given. As I told earlier, Ashwagandha Rishta and Lohasav played very important role in this to neutralize that hematoma. Ashwagandha Rishta and Lohasav is Ashukari and Sukshma Srutogami. So these Asava Rishtas played important role in the treatment of that hematoma. After continuous treatment, this result was seen, but again, the hematoma was completely dissolved, but there was another complication that the patient showed single umbilical artery, which resulted into IUGR. But there was positive sign that there was no subchorionic bleed. So again, the challenge was there, and one more challenge, that intermediate risk was shown in quadruple marker test. Still, we followed the clinical features and Nadi Pariksha and Garbhini Pariksha, and we asked the lady to continue her pregnancy. At the age of 30 weeks, again, she showed IUGR due to single umbilical artery. There was a lag of 2 to 2.5 weeks, and early changes of uteroplacental insufficiency was there. So oral treatment was continued and Kshira Basti was given twice weekly for 1 month. Suvarna Siddha water and milk was daily given. Udara Pichu was continued, and in this case, Buddhibala Kalpa was given, which for that intermediate risk in quadruple marker to avoid mental retardness and to achieve timely milestones in future. So in sonography, it was seen that the lag was reduced, but still there was a lag of 1 week. And another challenge was there that the oligohydramnios was seen in sonography. The amniotic fluid index was 6.5 and it was a moderate oligohydramnios. So in the treatment, we continued oral treatment, and at the 35th week of gestation, we give Badaradi Niruha, and after that, till delivery, Matra Basti was given of Kshirabala oil. Suvarna Siddha Lajajala was continued till delivery. And for this was very important for oligohydramnios. So, as a grace of Ayurved Chikitsa, on 39th week, she started labor pain on her own, and but due to some reasons and due to this history, there was emergency LSCS performed. We perform at that our hospital itself, and female baby with 1900 gram was delivered. Though the weight was low, baby was absolutely healthy. Apgar score was 9 by 10. All reflexes were good. The baby cried immediately, so no NICU was required. Healthy postpartum was there, and baby is achieving all the milestones timely till date. This is a baby. I think I'll skip this part. This is the Garbhashosh or IUGR case. I'll just discuss the case in 2 minutes. This is all theoretical part. We'll skip that. In modern, the specific treatment of IUGR is not given, only bed rest or nutritional correction, and it is mentioned in DC Datta textbook of obstetrics that at present there is no effective intervention to improve IUGR except delivery. But in Ayurveda, we have so many options to treat the IUGR. So this is the case, 28 years old, and there was a lag of 3 weeks fetal growth corresponding to 26 weeks by LMP, by USG, but actually by LMP she was 29 weeks of gestation. So these were sonography reports. You can see that the gestational age by LMP and USG was a lag, and also there was head circumference and abdominal circumference percentile was low. So in this case, we gave internal medication of Garbhopal Tappadi. The main treatment here was Kshirabasti of Ashwagandha and Shatavari. So 3 gram of Ashwagandha and 3 gram of Shatavari churna was taken with 50 ml water and milk. And by boiling it, we have reduced it to 50 ml Kshirapak and Basti was given. So the fetal weight was remarkably increased, and 800 gram weight gain after 5 Kshirabastis was there. The patient delivered a healthy male baby of birth weight 2525 gram, which was absolutely healthy. Apgar score was normal, and patient was absolutely fit and fine. This was the paper of that Kshirabasti, which was published in international journal. This was again another case of IHR. I'll just skip this. You can see that in sonography, the abdominal circumference previously was 15 percentile, but after 6 Kshirabasti, the percentile was increased to 41, and the patient delivered with a healthy female child with 2300 gram. This is again the case with cardiac echogenic foci, and there was aorta portal vein, umbilical vein anastomosis seen. The treatment was given. You can see the report. I don't have to explain this. In her sonography report, there was aorta portal vein, umbilical vein anastomosis seen, and aorta postvenous umbilical shunt was there. And then there was cardiac anomaly, and gynecologist said that it will need a intrauterine fetal cardiac surgery. Also, otherwise there will be IUD or stillbirth, and also there was short cervix which will need cervical circulation. So it is very risky to continue the pregnancy, but we gave her medicines, and a very important medicine in her combination was Shrunga Bhasma, which directly acts on Rudaya. And after that, we can see that the result was there was no shunt, ductus venosus appears normal, no fetal anomaly was seen, even uterine PI was normal, and we gave her Yoni Pichu, which was useful to avoid her cervical circlage as cervical length increased to 30 mm. This was again the another case with intracardiac foci. You can see the report. There was small isolated echogenic intracardiac foci in left ventricle. We gave Suvarna Malini Vasanta, Garbhopal Shrunga Bhasma, Tapyadi, and you can see the report that there was no intracardiac foci seen in 28 weeks pregnant, in 28 weeks USG, and Doppler was absolutely normal. Elective LSCS was done as the previous she was undergone with LSCS, and the male child with 2400 gram healthy baby was delivered. So what I wish to say is Garbha-Vyapad can adversely act on Garbhini, and vice versa, Garbhini-Vyapad can adversely act on Garbha. So with the help of Ayurved, complete treatment of Garbha-Garbhini-Vyapad, we can do that, and it is very important, and it should be done wisely using Yukti Praman. And as a Ayurvedic student, we can use this Yukti Pramana to save the life of Garbhini as well as Garbha. So these are some of the results of our Ayurvedic Chikitsa. Thank you so much.
Thank you so much. It was such a wonderful, very, very informative and valuable presentation, Vaidya Triveni. It was absolutely amazing.
Thank you.
Yeah, I love those demonstrations. Some simple remedies and simple kalpana.
Yes. Yes.
Everybody can make at home,
Right.
like Laja Manda and Narikel Mashi, Ela Mashi. That was,
Yes.
yeah, very, very helpful. And the case studies were absolutely fabulous. I mean, only with Ayurvedic, pure Ayurvedic Chikitsa, how, like we can bring so many such wonderful results. That was absolutely fascinating.
Yes. Thank you.
Yeah. Thank you everyone for attending our webinar. And it's really my honor to have my guru, my Vaidya Trilok Dhepeshwarkar joining this webinar. As well as I see there are some other Vaidyas also, Vaidya Yogini Patil and other some dignitaries here. It's really lovely to have all of you to be present at this webinar. And I would like to open up this session for any questions. So if anybody has any questions, please feel free. You can ask any question in the chat box, or you can ask by unmuting yourself. All right. So thank you everyone for attending
Thank you.
our webinar. Please watch and subscribe to our YouTube channel to view also the earlier webinars and other presentations. Please like, comment, and share the videos. Once again, I invite you all to become member and also fill out our volunteer form. You can now also subscribe to our IU Update newsletter to stay tuned to our projects as well as our events. If you have any questions, feel free to contact us at Ayurveda Research USA at gmail.com. You can also reach out to me. My email ID is asavari at mnayurveda.com. Thank you, everybody, again for joining us tonight. Namaste.
Yes.